is 29-year-old married female. The cancer diagnosis is primary mediastinal beta cell lymphoma. So I would like to ask Dr. Pagal sir about this. So she is a case of primary B cell lymphoma, mediastinal, and she's 29-year-old married female.
Yeah. So again, as is true with hematological malignancies, the cure rates are very high with this kind of treatment. The treatment mainly would involve 6 cycles of chemotherapy with an infusional regimen called as REPOC. Now, this case actually highlights the dilemma. So, some people with mediastinal mass would be in distress. They might have breathlessness, they might have cardiac tamponade, etc. A kind of SVC syndrome or an emergency situation where we may not have time. But other spectrum, people would only have cough or sometimes B symptoms, etc. So, depending on patient to patient, we will have a time, or sometimes we may not have time. Second thing is her long-term prognosis would be very good. Like cure rates more than 80% and above. And again, the risk of infertility with the treatment which we are planning with 6 cycles is in the low risk, less than 20 to 30%. Okay. And definitely she is in the reproductive age, and even for that kind of risk, I will not take a chance, and I will send her for counseling and appropriate preservation procedure.
Yes, sir. So if suppose that those are not other complications, and we get, usually do we get 2 to 3 weeks time for these kind of patients?
Yes, should be possible in most of the patients.
Okay. So I would like to ask Dr. Suvarna how we can go about these patients.
Yeah, so again, she's a 29-year-old married lady. So definitely after counseling, the option of embryo cryopreservation is open to her. And yes. If there is any urgency, we will immediately start according to the random protocol. But yes, if we have time, then it can be planned. Again, it will be an antagonist protocol with an agonist trigger, because we want to prevent the ovarian hyperstimulation and the complications related to ovarian hyperstimulation to this patient. And yes, and if random start, if it is a random start, we have an emergency, we can start in any phase of the cycle, may it be a follicular or late follicular, or in the even the luteal phase, as very well explained by you earlier.
Correct. So basically we have got, depending upon the time, we can decide the stimulation protocol and we can go ahead. And definitely, as sir had said, because it's a mediastinal mass, there can be other complications. So we should have the high risk team with us, the intensivist, medical team, and anesthesiologist to be involved in those things, and those risks have to be discussed. And as well as in the hematological malignancies, the risks of the platelet dysfunctions and the bleeding and all at the time of the pickup, that is also there, as well as the risk of the thromboembolism. So we might sometimes start a low molecular weight heparin during the stimulation, and it can be stopped just 24 hours prior to the pickup, and then immediately we can restart 12 hours after the procedure. But of course, that will be, those decisions are based on the team approach.